person you have called is speaking to someone.
हाँ जसप्रीत जी, डॉक्टर रिजुल बोल रहा हूँ। स्टूडियो में आप हो क्या? अच्छा, फिर जवाब नहीं आया महेंद्र जी। ऑडियो वीडियो चेक, ठीक है ठीक, ऑडियो वीडियो चेक करके गो अहेड बोल दो एक बार। ठीक है, ओके, थैंक यू। Okay, so good evening everyone. So we are here for the MDS 360 degree MCQ edition session, live every 8 p.m. Today myself, Dr. Rijul Agarwal, the orthodontic faculty at AIIMS, will be discussing MCQs on orthodontics. So I would like to have maximum amount of participation from the people to answer the questions so as to get a quick revision. Even if you are wrong, there is no harm in that. You can very well correct yourself, but don't hesitate to answer the questions. Okay, if you hesitate, then that will be more wrong for you, for your preparation. So I expect you to answer the questions, even if you are wrong, to make a wild attempt, because I'm not conducting any exam right now. We are here to just discuss the topic. Okay, so once again, good evening everyone, and thank you who all are joining on the Eve of Independence Day. Although it's a holiday tomorrow, but the exams are coming and exams won't wait and won't count your off days as holidays. Okay, so once again, good evening everyone. So question number 1: with a flush terminal plane, the permanent first molars will erupt initially end to end, initially into class 3, initially class 2, or initially class 1 relationship. I'll wait for a minute if anyone wants to answer, otherwise we'll move ahead with the discussion. The question is asking about will erupt and the options initially. So initially erupt into. Erupt. So this is class 1, class 2, class 3, or end to end. Someone says option A. Anyone else? Quite a simple and straightforward question. What I want to discuss would be the after effect or after part or something related to this question. As I've already discussed and have been telling regularly, each question has 4 options: 1 correct, 3 incorrect, and those 3 incorrect can form 3 more different types of question. So my request to every one of you who are preparing and are serious to look at each and every MCQ with that potential. Okay, even if you get this correct, look at why not B, C and D are the correct answer. Okay, because in your exam might be possible very well if this type of question comes. If not, examiner twist this question, because the syllabus and theory remains the same. Okay, it won't be like they will ask you something else out of the following. Like the question is on orthodontics, they will ask you something else, history, civics, geography. No, it will be related to medical science only the thing is examiner will try to twist the question. So coming back to the question, so yes, no one else is answering, so A is the correct answer. Okay, so what concept? This concept is based on the, first of all, flush terminal distal step and mesial step. This class concept is based on Bohm's classification. Okay, so this was given for primary dentition. Okay, for primary dentition, how the distal margins are related with respect to primary and primary second molars. So first type of question which comes, if any permanent teeth, mostly the 6, erupts, then this classification cannot be used. First type of question. Next type of question is the initial and what it will change or can change into. Okay, so there are two other types of question which is formed from this: initially erupt into and can change into. Okay, so they will, a distal step in the primary dentition will initially erupt into class 2. Flush terminal will initially erupt into end-on, and medial step will initially erupt into class 1. Okay, and they can change into. This is the next part of question which confuses people. Okay, they can change into a distal class 2 due to anything: forward shift of teeth due to late mesial, early mesial shift, or forward growth of mandible, the cephalocaudal gradient of growth can change into end-on. Okay, or end-on can change into class 1, and class 1 can become into class 3. It's not necessary that every time it will happen. They can change into. So this is the second part of question which you can get in your exam, which probably confuses students. And they ask me, then sir, you told us that it was end-on, then why in class 1 is the correct? So you have to read the question carefully, the language what they are asking about, and then answer. Okay. Next question. The tooth in lower arch most commonly malposed in arch space discrepancies. The tooth in lower arch most commonly malposed in arch space discrepancies. It should be C. Someone says premolar second. Okay. Anyone else? This is related to the eruption sequence. It also says option C, the common eruption sequence in the upper and lower arch. Okay, so yes, option C, permanent second premolar, is the correct answer. Okay, so the second premolar in the lower arch is the last to erupt. Okay, so by the erupting force of the second molar, there are high chances that the 6 gets drifted measly, not allowing the appropriate space for permanent second premolar to erupt. So next type of question, in which direction they are most commonly displaced? In lingual direction. Okay, and if this question has been about upper arch, okay, about upper arch, then the correct answer would have been canine. So in canine, it's in the upper arch, it's the canine which is most commonly erupted in buccal direction or buccally displaced canine, because of the simultaneous or sometimes simultaneous eruption of the first premolar and the canine, or sometimes due to inner arch length, arch space discrepancies. Okay, so the eruption pattern for lower permanent dentition is, okay, yes, you're right, upper arch it's canine. Okay, so I won't be astonished if the people who are attending the lecture would have this kind of problem, lingually placed second premolar or buccally erupted upper canine. Okay, it's the most common kind of chief complaint with which the patients reports to the orthodontic clinic for the correction. Okay, so if there is tooth size, arch length discrepancy or mesial drift of the permanent lower first molar due to early loss of deciduous, the second premolar has erupted and it will create insufficient space for it to erupt, leading it to lingual displacement. Next question is a very interesting question. The ugly duckling stage is characterized by all of the following except. Okay, so I would like you to give a good attempt, good look at this question and try to answer this question based on the rule of exclusion. It's not a direct question. Okay, so if people are, and give a wild attempt also, no issues if you even get it wrong. Okay, but try to answer this if possible with the rule of exclusion, because it's a very good and interesting question. The ugly duckling stage is characterized by all of the following except. Distoangular inclination of incisors, possible increased overjet, deep bite, mandible lateral incisors, lingual to central incisors. So someone says D. Okay, now I'm not here to test you. Okay, if it would have been a physical class, I would have asked you the reason behind your option D as well, so as to make this concept clear. But it's a very good and interesting question. Anyone else? Even if you're wrong, it's not an issue. D. Okay, okay, so I'll tell the correct answer. The correct answer is option C, that is deep bite. Okay, now most of you would have, what is a ugly duckling stage first of all? So ugly duckling stage is also known as Broadbent's phenomena, is characterized by the appearance of space or midline diastema between upper central incisors. Why it happens? Because of the erupting canine, which forces the roots of the lateral and centrals to flare out. Okay, and leading to development of space, which gets corrected automatically, also known as a self-correcting phenomena. Okay, now coming to the options. Distoangular inclination of incisors, everyone would have eliminated that option because it's a correct. Possible increased overjet, yes, so because what you have been looking at ugly duckling stage is from the frontal aspect only till now. You have not been taught or appreciated to look at it from lateral aspect as well. So what happens when the canine impinges on the roots of the first, it will come in contact with the root of lateral incisor. Now the lateral incisor root will might or might not also touch the root of the central incisor to begin its flaring away. Okay, so this root of lateral also acts as a guidance for eruption of canine. So in cases if the lateral incisor is missing or abnormally formed, so there are chances that the canine might get impacted also. Okay, so for canine impaction, one most common cause is malformed lateral incisor or absence of lateral incisor as well. Okay, so this is another fact which you should know. Coming back to the question, when it touches the roots of the lateral and central, it also leads to flaring of these canines. That means leading to their proclination as well. So that also gets eliminated, and most of you guys also eliminated them. Now coming to this option number C and D. Now deep bite is characterized by increase in overbite. Now when the incisors are flaring out, how is it possible to get a deep bite? So that's why I said, even if you don't know, you could have answered this with the help of rule of elimination. That's why it is very, very important to go and study MCQs and solve them as much as possible, so as to get yourself into that mindset of solving questions. Okay, because questions like this will come in your exam. Now every teacher will say you yourself would have studied ugly duckling stage in your second year BDS, third year, final year, and would have seen n number of cases. Okay, so no one could deny in the end that we haven't taught you ugly duckling, but what is important is to try and answer the questions and get a hang on the type of questions which you can get in your exam. Okay, so deep bite is not possible in ugly duckling stage. Coming to option D as well, mandibular lateral incisors lingual to central. So as I've told you, it first touches the roots of the lateral incisor. So because of that, the canine can also displace it lingually, slight lingual, as compared to the central, because the major effect will come on the lateral incisors. Okay, it should have been maxillary lateral lingual. So that's why yes, it's related to upper arch. Sorry, the maxillary lateral incisor. That's why you attempted option D. My mistake. It should have been maxillary lateral incisor lingual to central incisors. Okay, so that's my mistake. Okay, if well taken into account, if you attempted option D because of reading mandibular. Okay, it's maxillary lateral incisors lingual to central incisors. Okay, so deep bite is not possible. Okay, so that was my mistake. I'll take it into account if you attempted option D by reading mandibular. Okay, next question. So I hope you understood the concept behind this. Okay, next question. Which of the following statement is true? Forward internal rotation of maxilla is more than mandible. Forward internal rotation of mandible is more than maxilla. Both maxilla and mandible have same amount of internal rotation. None of the above. Again, correct statement. Try to answer this based on the rule of elimination. option B? Anyone else? So this topic of growth rotation is a very interesting and very important topic, okay, for your exam. So yes, option B is the correct answer, is the true statement. That is, forward internal rotation of mandible is more than that of maxilla. So this is the flow chart depicting the rotational depending upon the location of growth. So there is two types, internal and external. Total rotation is the sum total internal minus the external, that is approximately 3 to 4 degrees. Okay, so it's more than that of mandible is more than that of maxilla. Maxilla has total net zero rotation, okay, but in some places it does have rotation known as anti-inclination, okay, when it's forwardly rotated, okay, according to Schwartz classification. Okay, so this is the top summary of total as internal rotation and external rotation. Internal is core that revolves around the inferior alveolar nerve, okay, which is approximately 15 degree, and external is due to surface remodeling, which is approximately 11 to 12 degree. So total is internal minus external, that is approximately 3 to 4 degree reduction in mandibular plane angle during growth which occur. This value is also very important. Next question. Which of the following statement is not true or false as far as changes in the relationship of dental arches are concerned? Option A. No difference between the pre and post eruptive shapes and relationship of the upper and lower dental arches. Early in development, the maxilla is anterior to mandible, but on the adult, the upper anterior apical alveolar base is typically more posterior than the lower anterior apical base. Okay. Option C. Upper incisors are more labially inclined than lower. Option D. The shape of the mandibular posterior is wider transversely than the upper posterior during the prenatal period. So not true or false or incorrect statement, or all except common words written in your exam which come. Option A. Anyone else? I can see viewers but not answering the questions. Either you are too afraid or I don't know, because the questions are not so difficult. If you read them, you will be able to answer them. And as I've told you repeatedly, I'm not here to single out, pinpoint anyone why you're incorrect. I'm here to clear your concepts for the exam. Okay, anyhow, so the correct answer is option A, yes, that there is no difference between the post and pre and post eruptive shapes and relationships of the upper and lower dental arch. There is a difference. So early in the development, maxilla is anterior to the mandible, so a class 2 pattern is there. and the deciduous a predentate stage. Okay, whereas as the growth occurs, the adult stage, the upper alveolar area is more posterior than the lower apical area. That's why, okay, the upper incisors are labially inclined or proclined. That gives rise to positive over jet as the teeth erupt. And lastly, the shape of the mandibular posterior area is wider than the upper posterior area during prenatal period. That is also a correct statement. Okay, and as the growth occurs, the maxilla becomes wider transversely due to the mid-palatal suture. So mid-palatal suture ossifies later, whereas the mid-symphysis suture of the mandible ossifies much earlier. That's why you can expand maxilla. The transverse growth of maxilla continues till late and the mandible finishes early. So option A. Next question. So since it's my questions, I can frame up 5-6 options as well. So which of the following statement is not correct about PFE, that is primary failure of eruption of teeth? Caused by non-sporadic mutation, that is non-familial, means it's not hereditary in nature. Not familial, non-genetic, not hereditary, anything. In this, there is localized failure of eruption of permanent teeth with no other systemic involvement. Commonly affects the permanent anterior, commonly affects the permanent posteriors. Tooth which is affected is fully formed but are unable to reach the occlusal plane due to the primary defect in the eruption mechanism. Someone says option A. Okay, no one answered for this. For primary failure of eruption, the option A is for the previous. Anyone? The sixth question. Incorrect statement. So the incorrect statement is that it commonly affects the permanent anteriors. So it can be either syndromic or non-syndromic. Okay, non-syndromic factors, most common example is primary failure of eruption. So there is localized failure of eruption of permanent teeth without any systemic involvement is there. Mostly permanent posterior teeth are involved. Okay, the teeth are not obstructed by any structure, okay, and are neither ankylosed. So this makes the condition difficult to diagnose and treat among the anomalies of tooth eruption. Okay, so commonly CSF1, NF-kB and C-FOS genes are the primary etiological genes for the conditioning. Just remember these names of the genes, and I guys have a tendency to ask you about biomarkers and genes in their exam. Okay, so they have this tendency to just remember the names of these genes. Next question. So in deep bite cases, the freeway space is more than normal, less than normal, can be either more or less or cannot be predicted. It's a PYQ. Okay, previous year question regarding freeway space. So Gauri says more than normal. Okay. Anyone else? Okay, now guys are coming out. So that since it's a previous year question, people are answering it. Okay, good. Not a issue, but expect participation on other questions as well. Another variety of this question regarding freeway space is for class 2 and class 3 conditions as well. In class 2, what the freeway space is increased, decreased, class 3 increased, decreased. Okay, so yes, you're right. In deep bite cases, it is more than normal. So what is freeway space? It is around 2 to 3 mm. Okay, in complete denture, so it's posterior position used for differential diagnosis of deep bite cases. So how do you measure it? You put a marker on the nose and on the tip of the chin, measure the distance at normal VDR and video, subtract it, you get the freeway space. Okay, it's larger than normal in cases of inadequate vertical development and normal in cases of over eruption of incisor teeth. In class 2 cases, it is generally increased, that is approximately 7 to 8 mm, and in class 3 it is decreased approximately 0 to 1 mm. Class 1 it is 2 to 3 mm. Okay, so it's the other or different variety of question which you can get in your exam. Okay. Next question. The transition from juvenile to adult chewing pattern appears to develop in the conjunction with the eruption of. Now the question is about chewing pattern, not swallowing. Good evening. I think some people are joining late. Listening to President's address on the eve of Independence Day, I suppose. So make it a habit. 8 to 9, you have to attend the YouTube session. C. Permanent second molar, someone says. Juvenile to adult chewing pattern. There is question about swallowing as well and chewing as well. I have asked about chewing pattern. Anyone else? B. A. Gauri says canine. I have first molar. I have canine. 2 with canine. So the correct answer is, anyone else? HS says A, permanent first molar. Grit says C, permanent second molar. The correct answer is permanent canine. Okay, so it develops in conjunction with the eruption of permanent canines at about the age of 12 years. True, the second molars are also erupting at 12 years of age, approximately, also known as 12-year molar. Canine roughly 10 to 12 years range is taken. Okay, that's why the importance of canine guided occlusion is there. So as to have adequate good adult chewing pattern. Adult chewing pattern is different from juvenile chewing pattern, and swallowing pattern develops with the eruption of permanent deciduous lower incisors. So be careful what the question is asking about, chewing or swallowing pattern. Okay. Next question. The nasal resistance is maximum during which of the following growth phase? Pubertal, prepubertal, adolescent or adult? So please repeat, what if it's swallowing, what to choose? Okay, I'll go back to the previous question. So in appearance of adult or swallowing pattern from juvenile or infantile swallowing to adult swallowing occurs with the eruption of deciduous incisors, that is primary incisors, and the first incisors or first teeth to erupt is the lower incisors. Why? Because these incisors, when they erupt, they lead to the fall back of the tongue. So mostly by 18 years of age the transition starts and is completed by 4 to 5 years when the occlusion is established. Okay, so in swallowing pattern it is this, chewing pattern canine. Okay, clear? Coming to the ninth question. Maximum is during which of the following growth phase? Adolescent, prepubertal, someone says adolescent, prepubertal. This is another way of asking you about Scammann's growth curve. If I want to simplify this question, nasal resistance is maximum, means obstruction is maximum, means tonsils or lymphoid tissue maximum. They've just twisted the language and asked you. Someone says prepubertal. It says prepubertal adolescent. The correct answer is prepubertal. Remember the Scammann's growth curve. Lymphoid tissue reaches 200%, and thereafter, after the patient or at puberty, it starts to involute. So prepubertal, or the time just before puberty, it's at maximum size. So children in this stage present mostly with mouth breathing habit as well. Another variety of question, stage in child of this some age in prepubertal stage or before puberty, or they can give you any feature. So what will you do? Assure the patient. Increasing the nasal resistance. Again, twisting the same variety of question. Instead of asking directly about Scammann's growth curve, they have asked you in this way. Last question for the evening. Image based, 8-year child reports to your clinic with a complaint of spacing between upper front two teeth, the image of which is shown below. What treatment would you advise to such a patient? Start with 2x4 appliance, check for frenum attachment, give Hawley's appliance, or wait and watch. As a image, if I can zoom it for your convenience, if you would have read the question and the options, and zoom the image for a minute and then take you back to the options. Rit says D, Hansika says D, Gauri says B. Taking you back to the options, frenum attachment is present. Maybe due to ugly duckling stage. Anyone else? So the best treatment is wait and watch. I have repeatedly discussed this type of question. That's why I took this image in which there is high frenum attachment. And this question kind of images only come in exam, which confuses you with this. Even if there is a frenum attachment, you have to wait for the canines to erupt. You can clearly see permanent lat central, see the lingually displaced or palatally displaced laterals and deciduous canines. You have to wait. Child age is also mentioned. Sometimes these also is eliminated and you have to guess by looking at the image what teeth are there. Look at the lower, canines are erupting. So in stages early to middle mixed dentation stage. So you have to wait, even if the frenum attachment is so thick, you have to wait for the canines to erupt before doing anything. Even if in frenum attachment is there, no frenectomy, no frenal thing at all. So if it's after 10 years, then you can definitely go start the treatment, check for frenum attachment or anything. Or if the image shows that the canines have erupted, permanent canines have erupted. Okay, two ways. Other kind of options, frenectomy. Now amount of diastema is also mentioned in sub question, that you get 5-6 mm, hypothetical figure, 6 mm of diastema is there. Then also wait for the canines to erupt before doing anything, intervention at this stage. Okay, sometimes it closes, sometimes does not closes, but you will have to wait for the canines to erupt before intervening at all. Okay, I've repeatedly discussed this type of question. Image is just there to confuse you. Okay, showing high frenal attachment and all that. Okay, wait for the canines to erupt, then only intervene. Okay, so that's it from my side today. Long weekend ahead, Friday being off because of the 79th Independence Day. Okay, Saturday, Sunday. But as I've told you repeatedly, the exams date does not wait. Okay, your I9 notification is round the corner in a few days time. Requesting everyone to give that exam first of all. Okay, मेरा course नहीं हुआ है, half is left. No, do not ignore that exam. It's going to assess you, and with a full hearted attempt, not a half-hearted attempt. That exam should be given. Any doubts, as I have repeatedly told you, you can very well reach out to me. Any question of orthodontics, do not hesitate. I won't ask you कि कहाँ से पढ़ा, कहाँ से हो, from where are you, okay, which institute and all that. No, Any doubt, anything related to orthodontics, reach out to me anytime. You have Instagram, you have Facebook, okay, anything, WhatsApp, just message me and I'll answer. Delay हो सकता है. Sir, when you will be taking the lecture on aligners? The lecture I have taken on aligners is there on our app. Okay, you want a YouTube session, then I need to ask. Best book for IICET PYQs. Any book you can refer. I have repeatedly told you, no book, any book which says dental MCQs. When is next ortho class MCQ? Next Thursday. Okay, and IICET PYQs, any book you can say, Target you can take, Neeraj sir's book you can take, any book. Okay, plus best thing, okay, do not rely on the solutions of those books. Ask again and ask and verify. If you are not 1% doubt is there, even ask and verify that solution. Do not rely the solution and the explanation given in that book. That's all I am saying. No reliance on the solution. If you have any doubt, ask the respective subject faculty or a postgraduate student who will answer. Do not rely on the solutions of any book. I'm not targeting any teacher. There are problems in typing error as well sometimes, and the wrong information is conveyed. And lecture or aligners, it's there on the app. We are discussing. I'll try to discuss in the form of questions, aligners. Okay, so not to worry, I'll discuss. Aligners is not something a very big topic. You need to know the images, materials and all, not a very big thing. I'll discuss this in the form of a question next time. Okay, so you can write to me as well. I'll take it up, not to worry. Before your exam it will be done. So I'm not going to take a specific lecture. I'll discuss this in the form of a MCQ only. Okay, so that's it. I'll end my session. Hope it works. At least how many number of MCQs to be done in a day to get a good rank? 100 to 200. Your aim should be morning revising, evening MCQs, and if possible give a full course test, 2 to 3 minimum full course test per week. Full course. Right now it should be 2 to 3 per week. As your exam comes, 2 to 1 per day will also be there. Okay, 2 to 3 full course per week. Image question last only I included. Okay, I'll try to include more of them. As I've told you, images are not the only. You students get terrified of images. Okay, if I look at 200 questions, 170 to 180 questions will be without images. There will be 20 to 30 questions will be image. I know appliances images. Okay, so I'll take out of 10, 1 question will be an appliance image from now. Okay, so not to worry. But 9 questions will be on theory based only, because you guys are weak in theory and that creates a problem. So well taken into account, 1 question will be on appliance image and next on this. So upcoming IICET notification will be out, and mostly it comes for the January session, November exam and August end. Okay, so kindly keep a lookout. If it comes out, we get to know anything, I'll definitely let you know. Okay, so I was talking about the AIIMS PGI Common Institute of National Exam Importance Common Entrance Test, the November exam. So notification mostly comes out end of August. So you have time till September and to fill the form. October correction, November exam date for the January session. Okay, so image taken care of. Okay, so not to worry. So that's it from my side. I'll end the session. Thank you for your time.